At Riverside Hospital, everyone knew Lisa as just the night nurse, until that terrible night when the factory exploded. Lisa Thompson had been working the night shift at Riverside Community Hospital for 12 years. Her hours were 2200 to 800. Her day shift colleagues barely knew her. Dr. Williams always called her nurse. He didn't even know her name. The 42-year-old Lisa had moved to this small town after her divorce. She had left a prestigious hospital in the big city, seeking a quiet life. The night shift was perfect for her. Minimal human interaction, minimal social drama. Just her patients, and her duty. That night was like any other. When Lisa went up to the third floor, Secretary Jenny nodded slightly at her. "Looks like it'll be another quiet night," Jenny said. Lisa smiled. Quiet nights were good. Less stress, less chaos. "I hope so," Lisa said, organizing the hospital reports in her hands. "Mr. Morrison's fever has risen again. I'll need to monitor him throughout the night." Jenny looked at her computer screen and murmured, "You're lucky the ER is calm too. Dr. Martinez is almost falling asleep." But Lisa didn't know yet that the biggest test of her life would begin in just 4 hours. At 23:30, the last visitors left. Only the emergency room, intensive care, and the internal medicine ward Lisa was responsible for were active in the hospital. There were 32 patients that night, most elderly, most with chronic illnesses. Lisa had memorized each of their names, even knowing some of their family situations. Mr. Morrison in room 15, 78 years old, living alone, his son in another city. Mrs. Clark in room 22, diabetic, her daughter visits every day. Lisa cared about these details, because throughout the night, these people were her responsibility. 2:17 a.m. Lisa was taking Mr. Morrison's temperature in room 15 when she heard a distant rumbling. She looked out the window. Orange flames were rising from the Chemtech factory on the outskirts of town. At first, she thought it was a car accident, but the size of the flames and the intensity of the explosion sound indicated something different. Lisa's heart raced. 15 years of nursing experience had taught her to recognize danger early. She took out her phone and checked the news. Nothing yet. But her gut feeling wasn't wrong. Something big had happened. The first ambulance siren was heard 7 minutes later. Then, the second. The third. Lisa ran to the emergency room. As she passed through the corridors, she was calculating in her mind. How many beds are free? Which doctors are on duty? What supplies are available? At that moment, Lisa didn't know how she would handle what she would see in the emergency room. There was chaos at the emergency room entrance. Dr. Martinez was shouting in panic. "How are we going to take this many injured? We only have 8 beds, Nurse Assistant Amy was crying. Security guard Rodriguez was trying to get information from the radio. "There's been an explosion at the factory. At least 40 injured. Lisa quietly assessed the situation. 4 injured in the first ambulance, 6 in the second. The third was still being unloaded. Voices from the radio said more ambulances were on the way. The factory had 150 people working the night shift. Dr. Martinez was sweating. "Lisa, go back upstairs. We have work here," he said hurriedly. His hands were shaking, his eyes shining with panic. But Lisa didn't move. Her eyes were scanning the injured. The man on the left had fainted, but was breathing. His chest was rising and falling regularly. No life-threatening danger. The woman on the right was screaming, blood coming from her leg, but it wasn't arterial bleeding, no life-threatening danger. But the young man on the stretcher had blue lips, a sign of hypoxia. Lisa's mind went to the emergency training she had received at the big city hospital. Triage protocol, red, yellow, green bands, priority ranking, system. It was at this point that the power within Lisa began to awaken. "Dr. Martinez," Lisa said in a calm but determined voice, "treat the patient with blue lips first. He has respiratory distress. The screaming woman can wait." Dr. Martinez was surprised. He turned his eyes to Lisa. "What are you saying?" "I'm the doctor here." "Triage protocol," Lisa said calmly. "We need to prioritize life-threatening cases first." Amy was also surprised. She had worked with Lisa for 3 years but had never seen her like this. So determined, giving such clear commands. Seeing Dr. Martinez hesitate, Lisa continued, "Doctor, if we don't take a systematic approach, chaos will increase and people will die." Seeing Dr. Martinez hesitate, Lisa turned to nurse assistant Amy. "Amy, bring the red bands. We're going to separate the injured by priority." Amy looked at Lisa as she ran. "How are we going to do this? Nothing like this has ever happened before." "I've experienced situations like this in the big city," Lisa said. "There's a system, we just need to apply it." When the next ambulance arrived, Lisa was outside. She was quickly evaluating each injured person, making red band urgent, yellow band can wait, green band minor injury distinctions. Her eyes trained, her hands calm, her voice clear. She looked at the first injured. Respiratory status normal, consciousness clear, minimal blood loss, green band. Second injured, chest pain, shortness of breath, cyanosis present, red band, urgent intervention. Third injured, open fracture, bleeding under control, vital signs stable, yellow band. At that moment, the natural leadership in Lisa emerged, just like the strength that comes from within you in difficult times. "This man is red," she said, looking at the injured on the stretcher. "Suspicion of internal bleeding, pale complexion, rapid and weak pulse." "Amy, prepare this one directly for the operating room." Dr. Martinez was now listening to what Lisa said, because the system was starting to work. Chaos was giving way to order. "Lisa," Dr. Martinez said, "how do you know these things?" "I worked in the emergency room at Metropolitan Hospital for 8 years, Lisa said, evaluating another patient. "I also volunteered after 9/11. 3:45 a.m. A total of 23 injured had arrived at the hospital. Lisa was using the emergency room's 8 beds with maximum efficiency. Red-banded patients to the doctor, yellow-banded to nurse assistants, green-banded waiting. But the problem wasn't just the injured. Their families were starting to arrive too. The corridor was overflowing, crying sounds, panic, confusion. Lisa suddenly had to think multidimensionally, not just medical priorities, but logistics, human resources, space management. "Amy," she called out, "move the green-banded patients to the cafeteria area. You can do simple interventions there too." "What about the families?" "Call security guard Rodriguez. He'll gather the families in the conference hall. Regular information will be given." But the real crisis hadn't come yet. Lisa went to the secretary's desk. She called the hospital director. "Mr. Johnson, we need to activate the emergency plan. The cafeteria should be a temporary treatment area. Also call the blood bank. We need blood." "Lisa, who are you to make such decisions?" Mr. Johnson shouted on the phone. "I'm someone trying to save lives tonight," Lisa said calmly but determinedly. "You have 20 minutes. Either you make these decisions or the losses begin." After hanging up, Dr. Martinez came over. "Lisa, how can you stay so calm?" "Because panic is a luxury," Lisa said, going to meet the new ambulance. "People's lives depend on us." 4:20 a.m. The most severely injured arrived, a 28-year-old factory worker, Mark Johnson, third-degree burns and respiratory arrest. 40% of his body surface was burned. The ambulance paramedic gave Lisa information. His heart stopped twice on the way. "We brought him back twice. Very critical. Dr. Martinez was tired now. He had been working non-stop for 4 hours. This is too severe. Let's transfer him to a big hospital." "Ambulances are busy," Lisa said. "The nearest big hospital is 45 minutes away. He can't make that time." Lisa leaned over the patient. She checked his pulse. Very weak, blood pressure low, respiratory failure. "Doctor, intubation is needed. Now." Lisa faced an impossible choice. Just then, the patient's heart stopped. The monitor started drawing a flat line. Alarms were ringing. Dr. Martinez panicked. "Where's the defibrillator?" Where? Lisa had already prepared it. The defibrillator was standing next to her. "Doctor, let's start with 200 joules." "Lisa, I make the decisions. Then decide." "Fast." Lisa's voice was calm but urgent. "We have 1 minute." The patient's wife was crying in the corridor. "Mark! Mark!" she was shouting. She had 2 small children, ages 5 and 8. Dr. Martinez handed the defibrillator to Lisa. "You do it? You're calmer." Lisa placed the electrodes on the patient's chest. The positions were perfect. 15 years of experience. Everyone stand back. Charging, first shock, monitor silent, flatline continues. Lisa started chest compressions. Amy, prepare epinephrine. Second shock, still flat line. Lisa's heart was beating fast, but her hands were calm and sure. Sweat drops were flowing from her forehead. If he doesn't come back after the third shock, Dr. Martinez couldn't finish his sentence. He will come back, Lisa said with determination. He has to come back. What happened after the third shock would change Lisa's life forever. She repositioned the electrodes. Everyone stand back. Last chance. Third shock. A moment of silence. Then the monitor made a sudden jump. Heart rhythm returned, irregular but present. "We have a pulse," Amy shouted. The patient started breathing. His eyes opened. "My wife. Children," he mumbled. Everyone waiting in the corridor applauded. Dr. Martinez looked at Lisa. There was admiration in his eyes. "Lisa, how did you do this?" "I didn't give up," Lisa said simply. She was checking the patient's pulse. "People don't expect me to give up." 7:30 a.m. The last injured had also received treatment. A total of 41 people. No losses. Lisa's triage system had worked perfectly. The hospital corridors were beginning to calm down. Families were visiting their loved ones. The rescued Mark Johnson was holding his wife Sarah's hand. Hospital director Mr. Johnson arrived. He saw Lisa standing in the corridor. For the first time, he was seeing the night nurse this closely. "Lisa Thompson, did you organize this?" "I just did my job, Mr. Johnson." Lisa was tired, but there was peace in her eyes. Mr. Johnson looked around. The system was still working. Everything was in its place. The injured were appropriately distributed. Families were informed. Supplies were organized. But what Mr. Johnson was about to say would surprise Lisa. "Lisa, what you did last night. I haven't seen such organization in this hospital in 20 years. An emergency coordination position has opened up. Day shift, good salary. I want to offer it to you." Lisa smiled modestly. "Thank you, Mr. Johnson. But I'm a night nurse. This is my place." "Why?" "Day shift is more prestigious. You'd be more recognized." Lisa looked out the window. The sun was rising. When the factory exploded at midnight, there was no day nurse. "I was there, that's why." Dr. Martinez was waiting for Lisa at the door. "Lisa, last night, I'm sorry. I never saw your talents. We've been working together for 3 years, but I didn't know you." "It's okay, Dr. Martinez. We worked as a team. That's what matters." Dr. Martinez shook his head. "No, Lisa. You led. I panicked. You stayed calm. You made decisions. I implemented them." Lisa smiled. "Maybe that's why I'm a night nurse. The silence of the night gives me a chance to think." But Lisa's answer would surprise everyone. "Do you really want to stay on the night shift? Everyone knows you now. This is the opportunity." Lisa looked out the window. Evening was falling. Her shift would start soon. Lights were on in the hospital. Inside there were sick people, waiting families. "Yes," she said, smiling. "Night shift is my place, because being with people in their darkest moments, that's real heroism. Not heroism that gets applause, but heroism done quietly." "What about recognition, prestige?" "Dr. Martinez, we saved 41 people last night. Their families can hug their loved ones. This is more valuable than all prestige." At noon, the local news channel came. The reporter found Lisa in the hospital garden. "We're talking with the night hero Lisa Thompson." "Ms. Lisa, what did you experience last night?" Lisa was shy in front of the camera. No makeup, tired but with peace in her eyes. "I just practiced my profession. Any nurse would do the same. But organizing 41 injured, not losing anyone, this isn't ordinary," Lisa thought. "You know, I've been a night nurse for 12 years. People generally don't see us. But I realized that night that being invisible is sometimes an advantage, because there's no ego, just duty." But the reporter's question filled Lisa's eyes with tears. "How do the family's thanks make you feel?" Lisa paused. Her eyes filled up. "Mark Johnson's 5-year-old daughter hugged me. She said, 'Thank you for saving my daddy.' At that moment I realized being with people in their darkest moments is the most valuable thing in the world." "Why did you choose the night shift?" Because at night everyone is vulnerable. There's fear at night. There's loneliness. People need hope most during those hours. I try to be that hope. After the news aired, hundreds of thank you messages came to the hospital. Families of factory workers sent flowers. The hashtag Night Hero went viral on social media. 6 months later, Lisa was still a night nurse, but now everyone in the hospital knew her. She had also taken over the coordination of the emergency plan. Riverside Hospital had the best emergency response system in the region. The 28-year-old factory worker, Mark, whom she had saved that night, visited Lisa when he recovered and was discharged from the hospital. His wife, Sarah, and 2 children were with him. "I'm alive because of you," he had said. "My children can hug their father because of you." Lisa's answer was simple. "I was just there. Right time, right place." Mark's 5-year-old daughter Emma had hugged Lisa. "You're a real angel," she had said. Every night when starting her shift, Lisa remembered that night. She would say to herself, "Maybe tonight I need to be someone's angel too." Jenny smiled at Lisa from the secretary's desk. "Looks like it'll be another quiet night." Lisa smiled. "I hope so. But if not, we're ready." This is what real heroes are like, without making noise, without showing off, just for humanity. Thousands of night nurses like Lisa Thompson quietly save lives every night. Do you see them? Do you notice them? Because they are there for you, every night quietly, just to be there when you need them.